My one word for acromegaly, extreme.
Para mí la palabra que define acromegalia es resiliencia.
Okay, resilience is the word with David described this disease.
If I had to use one word to describe acromegaly, it would probably be exhausting.
I would describe acromegaly in one word, probably as challenging.
My first symptoms were that I feel very bad, very with low energy, and I had a lot of headaches, and also I couldn't get pregnant.
So for about 6 years before I was diagnosed with acromegaly, and I had all the symptoms but not knowing what they were. So that was, I had very bad apnea, which was a fairly scary thing. You know, you're waking up, being able to breathe and all that kind of stuff. So that was a significant one, really bad one actually. The other thing was, you know, there's other smaller parts, but constant, you know, sweating, and you just couldn't control your sweating, weight gain, and then joint pain, which was incredible.
I felt the change for some years where I felt that I wasn't myself, whatever that means, but I felt that something had changed. And the one thing that was really disturbing was that I used to fall asleep at really inappropriate places. I once fell asleep at a very good concert, and another time, even worse, having a conversation with a friend, only for a second, but I did fall asleep. So I went to see a doctor to get a really thorough examination. And he said there was nothing wrong except that I had apnea. But I still knew that something was wrong. So I went to see a neurologist at some point because I thought that, you know, I couldn't remember so well anymore, and what was this? And he said there was nothing wrong. I was, you know, like a young girl, like they say, you know. So I said, no, it's not true. There is something wrong. Can't you see? My lip has grown, I'm lisping, and I have a lot of symptoms that I can't account for. And he said, okay, since you are insisting, and I will make a scan. But then we'll both laugh, and there's nothing wrong with you. And of course there was, and I had acromegaly, and I had a walnut big tumor. So it was a shame that I wasn't diagnosed before, but then again, it's a very difficult disease to see, and even doctors don't see that very often.
It's difficult to really describe when I first noticed changes in my health, because with acromegaly, so many of them can come on from such a long period of time. But I guess the most noticeable ones were when I started noticing changes in my hands and feet. They started to swell, and also some really distinct facial features.
Los primeros síntomas y cambios que noté en mi salud con acromegalia fueron los dolores intensos todas las noches en mis manos y pies. El cambio físico también fue muy notorio, ya que partes de mis facciones pues habían cambiado, ¿verdad? También los insomnios, no descansaba bien, muchas de las alimentaciones pues tuve que cambiarla porque todo me hacía daño.
I had many symptoms. I was completely exhausted. I had joint pain, extreme headaches. My hands and feet grew. My facial features totally changed. I gained weight. I had many more skin tags, and my skin became very thick and oily.
My GP had made various referrals unsuccessfully. My biggest problem was headaches, joint pains, carpal tunnel syndrome, sleep apnea. My GP eventually then referred me on to a rheumatologist, and he took one look at me and said, has your facial features changed? Has your shoe size changed? All which of course had, and he said, I'll do an MRI scan and I'm sure you've got acromegaly. That period took about 5 years, and I was in my 40s then.
Even though I was diagnosed when I was 24, the journey from symptoms to the actual diagnosis probably still took between 5 and 10 years. So from noticing symptoms around joint pain, changes in my voice, obviously the hands and feet, and some other symptoms as well, all took quite a long time, and definitely around 5 years.
One of the first symptoms that I've experienced was hyperglycemia. I was hospitalized due to high blood sugar. And when I was admitted in the hospital, there are a lot of tests that conducted by the doctors and medical professionals. And one of the procedures that is done is a CT scan. After the result of the CT scan, we found out that there is a small lump on my pituitary gland. And the doctor said that it might be a pituitary adenoma, a type of a pituitary tumor. After that, the doctor wants me to confirm it via MRI for a more detailed scanning. I was lucky that I'm in the right medical team, I'm in the right medical practitioners, and they were able to diagnose me at an earlier stage. So everything has been done. I've done with my MRI, I'm done with my laboratory procedures, and it was confirmed that my diagnosis was pituitary macroadenoma. So at that time, the doctor confirmed that I have acromegaly.
I ended up getting diagnosed after having surgery on a knee by after the practitioner said to me, "Look, don't get mad with me, but I've never seen feet as big as that." So I had a size 14, but when it grown from 11 to a 14, and that's excuse me, that's actually what turned it for me. He recommended I go and see someone who it wasn't normal and right. So
por el proceso que pasé desde los síntomas hasta el diagnóstico, fueron 5 años, 5 años de sufrimiento.
I probably had the disease for 5 years when I look back at the pictures, because I've changed physically, and I just thought, you're getting old, that's it. But now I can see when it started, and when my jaw started growing, and my nose started growing, and my lip started growing.
Well, finally, after 5 years, I found my diagnosis, and it was not an endocrinology, it was a fertility specialist that said me that I have something in the pituitary gland, and this was the first time that I heard about pituitary gland. And I remember that I went to almost 8 physicians, and the problem with this kind of illness is that you have several symptoms and nobody could study all of them.
The day I was diagnosed was a happy day for me, as I had been misdiagnosed for many years. I met many doctors and consultants that all told me the whole thing was in my head.
What I feel when I was diagnosed with acromegaly, of course, I'm afraid. I don't know what this thing is. I don't know what acromegaly is. And the time that I was diagnosed with acromegaly, I am searching for support groups because I don't have knowledge at all what this condition really is all about. So in the Philippines, there are no groups about acromegaly. prior to my diagnosis. I don't know how do I manage, or I don't know how do I survive this condition. I don't know if it's cancerous or not. But with the help of different international acromegaly groups, I was able to find a home. I was able to find, a support group that will really help me to move forward with this condition. Of course, the initial concern of my medical professionals or my medical team is to control the IGF-1, control the symptoms of acromegaly, and of course to had my surgery and everything to be prepared so that I will be able to overcome the symptoms of acromegaly.
Mis preocupaciones cuando tuve el diagnóstico, una de las preocupaciones fueron el medicamento, el tratamiento, ya que se me habló de que era un tratamiento costoso, la cirugía, pues era muy difícil de obtener la cirugía por medio del seguro social.
Actually, in the beginning, it was a very great relief, because that was the proof that what I had been feeling for several years was quite right. And so they said, I could have surgery, and the prognosis was good, etc., etc. So that was a great relief. But I didn't understand that this was a chronic disease, and it probably is not a chronic disease for everybody. That's what they say. But I've only met people with acromegaly who have it as a chronic disease. And I think that this is a very important issue, that patients understand that even after surgery, you will have or may have some comorbidities.
Today, after a few years, I have a hormone replacement, all the things that pituitary gland can do. I'm taking medication. So today I have, thyroid, I have also cortisol, and some cholesterol and this kind of medication, but I'm very well.
My treatment for acromegaly included transfernodal surgery by 2 in 2005, again in 2006 because I still had tumour residue, followed by radiotherapy. I still have ongoing tumour residue as well because my tumour was very close to the optic nerve, so they couldn't remove it completely. Unfortunately, my growth levels never really came down over the years, so I had to have various forms of monthly medication. I'm on hydrocortisone permanently. I take a daily injection called pegvisomant, which kind of acts by blocking the tumour residue, but it doesn't really kind of get rid of it completely. So that's my treatment. My growth levels tend to go up and down. The minute they reduce the medication, they tend to fly back up again. So I'm on 30 milligrams of pegvisomant daily. I'm also have developed over the years, as a side effect to that, osteoporosis. I live with osteoporosis now, quite bad in my joints. I manage that obviously with treatment under the osteoporosis clinic.
I had 2 surgeries and they helped greatly for periods of time. And then you go on medications. But bones that have grown excessively don't reverse once you get the diagnosis, once you get the surgery, once you get them, they don't reverse. My left kidney is twice the size of my right. It works, thank God. But so it leaves a lifetime print on you.
A couple of days after my diagnosis, I was sent for surgery. This surgery did not go as planned. I ended up with a CSF leak, which led to having a spinal tap, which didn't work, and a further 2 surgeries to fix this leak. It took me weeks to recover. Today, many years on, I'm still suffering. My tumour is back and is the same size as before surgery. I'm currently on medication to try keep this tumour at bay. I travel the world looking for help, clinical trials, or just maybe a glimmer of hope that someday a medicine will be found to cure this disease.
In 2021, September, I was first diagnosed with acromegaly. In October or November 2021, I already had my transsphenoidal surgery to remove the pituitary tumor in my pituitary gland. After the successful surgery, I went radiation therapy February 2022 in order to make sure that the tumor itself will prevent from regrowth or from growing again, and of course to control the hormones in my pituitary gland. Luckily, after the surgery, after the radiation therapy, my growth hormones pretty decreased, and it really decreased, and I really felt good in terms of my symptoms and in terms of everything that is happening when I was first diagnosed with acromegaly.
I was retired at the time, but I've always been writing, and I've been very active doing all kinds of work. So what I find is that I can do it half time. Until 1-2 o'clock, I will be fine and concentrated and fresh. And then I start getting these fog things, and I look at my clock and I say, oh, that's it. So it's half time, but well, I'd rather live full half time than half time all the day. So it's okay, but it's something that it's also something that you have to live with and get used to. I don't find that any friend would distance me or anything like that, or family, but on the contrary, they never ask. They don't ask, how are you? It's, I don't know, I felt myself in the beginning that the disease was taboo. And I don't know if this is part of what friends feel, because nobody really knows the disease, what it is. And, or it's a kind of, well, you don't want to upset the person who has acromegaly. Later I learned that this is also a problem for people who have cancer, that friends don't ask, how are you? And that would be lovely if people could just say, how are you?
It certainly gives you a very poor quality of life. And when you have kind of those kind of things going on, I put on 5 stone in weight without changing my diet. And you become kind of conscious of it all. And then I suppose what it does too is you stop doing stuff that you normally did, socializing and that kind of stuff. So it has both a physical effect on you, but equally, and as important, it affects your mental health as well, because you don't know what's going on. The effects are physically, mentally, socially. It changes your words.
Esto ha afectado emocionalmente mi salud, emocional y psicológicamente, pues ya que hasta el momento la verdad no he recibido ayuda psicológica. Ha sido muy difícil porque pues con mis propios esfuerzos, buscando alternativas emocionales y pues el apoyo de mi familia, pues he podido saber conllevarme bien con la enfermedad.
Acromegaly have really changed my life as a whole. Acromegaly really changed my personality, and of course, it really gave me my life purpose to be an advocate of acromegaly. Acromegaly makes me stronger. Acromegaly taught me how to be resilient, how to be strong, and how to be faithful, that you will be able to surpass whatever challenges it is that you are doing. And because of acromegaly, I was able to make and establish the support group of acromegaly patients here in my country, in the Philippines. I am the founder of the first acromegaly patient support group here in the Philippines. And I'm so lucky and happy to have a new family that will support each other and continue to strive to fight for a better health and fight for remission.
The impact of acromegaly on my mental health and well-being is quite difficult to quantify. There's definitely ups and downs. I think having different treatment that's needed, having to go back and have surgery 20 years later definitely has an impact. It's great that I've got a good support network, but I think it's just up and down.
It's a roller coaster, it's challenging, but it's livable, and it's never stopped me living my life. I've always kept working. I'm a nurse. I'm just about to retire now, but I've not let it get the better of me. But it is challenging both physically and mentally.
Cuento con los recursos e información necesarios para llevar mi condición día con día, logrando así el conocimiento de mi enfermedad.
Oh, good. Well, David tell us that at this moment he has all the needed information and resources to carry his condition day with day, achieving in this way the knowledge of his disease.
What I wish was that there would be a group taking hold of you when you got the diagnosis, if you need it. Maybe people don't need it, but that it would be a possibility. Somebody should inform the caretakers that the person you now live with is actually a different person. I have a friend whose husband tells her, "I don't recognize you from the outside, neither from the inside." That must be so tough, because this is exactly how I feel. I don't recognize myself, and I don't like what I feel. I don't like what I look like. It's something that it takes a long time to get used to, that you get a new personality that does not really live up to the standards of the old one. Also, most of us put on weight, and that's also very, well, how should I say? It's bad for your own image of yourself. It's not anything that anybody from the outside may notice, but you know it yourself, that you change psychologically, but you also change physically. And that was one of the things that might be considered, that we try to get the disease recognized as one where you could get help losing weight.
The most difficult thing about the future of acromegaly and what that means for my health is, I guess, the unknown. I've had it for such a long time, and whilst I'm really lucky that we think it's controlled now and the tumour has gone, we don't know what it's done to the rest of my body and the changes, and whether they will continue or whether anything will be exacerbated as I get older.
Fortunately, I feel very well. I'm very excited about the future. I feel every year I feel better. Well, this is my message for all the acromegaly patients and acromegaly community.
Well, to me, because at the stage that I'm at now, it's just really, for me, it's having a good relationship, which I do have with my general practitioner and his staff over there. So if something pops up, I can go, and they're very good to look after me. Also, I have two, as I said to you, one in Dublin and one in Waterford, one in up the country and one closer to me, and who are really enormous people in terms of pituitary problems. So thankfully, look, not much more they can do. They've done what they could do in terms of it's just keeping an eye on me, and who knows what's around the corner, but that's the way it is. You don't know. Look, all I wish for is that more people can get diagnosed. That's all.
I would say really that we also have support groups here, and that is a very valuable source of support. Talking to people, whether it's online, whether it's through the Pituitary support group, whether it's sometimes we have monthly meetings. They did kind of have to stop them in COVID times, but they've redeveloped.
The support of the people that surrounds you, such as your family, your friends, and your loved ones, will definitely give significance to your journey in battling with this rare disease, which is acromegaly. I can really say that each and every one of us are really strong, and I believe that if your medical practitioner and your medical team is competent enough to diagnose your condition, you must be confident that you will go in remission.